Hello, I am Soraya Giulicanti, and I am presenting this poster on our pharmacist's role in primary care during the COVID-19 pandemic. Primary care clinic staff are now constantly being called by patients to provide guidance on navigating this pandemic, current established COVID-19 symptoms, and other COVID-related concerns. Patients with respiratory and COVID-like symptoms have now become a greater percentage of patients who primary care clinics are caring for. However, studies show there are fewer patients overall receiving care from primary clinics in comparison to the previous year, even while considering telehealth visits. This pandemic has created a gap in care that primary care services have been attempting to close for decades, and pharmacists may be the answer for treating some of these patients. The implementation of social distancing and the ideology of limiting non essential exposure to others has been beneficial in lowering COVID cases across the country. However, many patients have misunderstood visits with their primary care physicians, PCPs, as non essential. PCPs have been spending less of their time on patients who need uncontrolled chronic disease state management, who account for many of these missing patients. Unfortunately, these patients would also be the most severely impacted if they contracted COVID. Other patient demographics fall in this high-risk group as well. Patients with poor health literacy, lower economic status, a history of experiencing domestic violence, the elderly, or immigrants are all in precarious health. Postponing routine visits until after the pandemic will cause patients greater long-term harm for those who need consistent monitoring. The medical field must now restart a public health initiative of patients investing and prioritizing their health first. Pharmacists are uniquely trained to work with patients with uncontrolled chronic disease states, such as diabetes, high cholesterol, and hypertension, by optimizing their pharmacotherapy. A pharmacist dedicated to these patient populations provides the primary care office a greater capacity to work with the most at-risk patients during this pandemic. Shown here are a few of a primary care pharmacist's workflow procedures and responsibilities. Pharmacists review patients' current medications. This entails creating up-to-date lists of all their current medications. They also simplify any duplications of therapy and optimize the dosing of their medications to stop any initial under or overdosing prescribed by the PCPs or nurses. They also resolve drug interactions, monitor the patient for adherence, and also learn about the patient's concerns towards their regimen. Understanding what symptoms the patient is experiencing and how the medications are affecting them provides the pharmacist a greater insight into how to best optimize their therapy. They may also promote antibiotic stewardship. Uh, However, they must update the patient's physician and care team of any required medication changes. Last, they counsel the patient. They work closely with the patient to create therapeutic goals and implement lifestyle modifications such as exercise and diet alterations. These efforts are all to promote the patient's investment in their own health and well-being. The following models show how many uncontrolled chronic disease patients that just one pharmacist can work with over a 6-month time period. The pharmacist's work schedule will be 8-hour days, 5 days a week. Each day, 6 hours are for patient visits and 2 hours are for charting, attending meetings, working with PCPs, and performing other administrative duties. Each patient with uncontrolled diabetes, cholesterol, or hypertension has an initial 60-minute visit with the pharmacist and then 2 follow-up visits, each 30 minutes long and 8 weeks apart. The figure to the left shows how just one pharmacist can work with 448 patients within just 6 months. Pharmacists are proven to have a highly beneficial effect on patients with uncontrolled diabetes. One study looked at how many patients' A1Cs can be lowered to below 8%, the time needed to reach this goal, and the degree of A1C lowering that pharmacist-led treatment can provide. Pharmacists brought more patients' uncontrolled diabetes under control after both 3 months and 6 months compared to physicians. Patients in the pharmacist-led team also had the greatest A1C reductions in shorter periods of time, as 0.95% lower at 3 months and 1.19% lower at 6 months than physicians did, who achieved 0.54% lower at 3 months and 0.99% at 6 months. In these visits, they were able to provide greater patient care while still working with the patient one-on-one to have them involved and invested in their own health. Pharmacists have also been able to considerably lower uncontrolled LDL, HDL, and triglyceride levels for patients. In a study where the pharmacist was working with a physician to treat patients with these uncontrolled conditions, the pharmacist and the physician group achieved significantly more than just the physician group alone. When the pharmacist and the physician collaborated, twofold of patients achieved controlled lipid levels. Pharmacists decreased cholesterol levels on average 44 milligrams per deciliter per patient, whereas the physician-only group decreased cholesterol levels on average 13 milligrams per deciliter per patient. They also provided more effective care to patients who had coronary heart disease or any other atherosclerotic cardiovascular disease events in the past. Pharmacists are skilled clinicians who are well suited to adjusting therapies for hypertension patients as well. In a study of 100 randomized controlled trials, pharmacist-led medication management had greater positive effect on patients' blood pressure control in comparison to physician-led management. Another study analyzing the effect of pharmacist-led interventions with uncontrolled blood pressure patients showed that the pharmacist brought the blood pressure of 43% of patients under control. In comparison, the control group of physician-led care brought only 34% of patients under control. Patients in the pharmacy-led team also had greater reductions in systolic and diastolic blood pressures in comparison to the physician-led group. During this COVID-19 pandemic, many patients in need of extra assistance managing their uncontrolled chronic diseases have been struggling. They are unsure whether maintaining routine monitoring visits is worth risking exposure to COVID-19. Postponing their visits, in turn, causes greater long-term harm to their own health. Utilizing pharmacists as the capable clinicians they are trained to be will ensure that these patients are receiving the best care possible during this pandemic. Pharmacists will become an essential piece in the new public health initiative to care for the patients who fell through the cracks during the chaos of the COVID-19 pandemic. Thank you for your time.